So Mr. Lockhart, he was without symptoms, but went to his primary care doctor just for a checkup, and his primary care listened to his heart. On listening to the heart, he heard a murmur. A murmur is a noise, a flow across something, and this was across a valve, actually. He was sent for an echo, and the echocardiogram showed that he had severe stenosis, or thickening of the aortic valve, which is the valve that leads the blood from the heart to the rest of the body.
When I went in for a checkup, we found out that I needed a three-way bypass, and the aortic valve had severe stenosis. And I guess that's something that I have had all my life. And I had no pain to indicate I had a problem.
Well, that means severe can become critical and people can die suddenly without any symptoms. Immediately I sent him for further evaluation with the surgeon. So he was really saved by a primary care doctor listening to his valve, listening for that murmur.
And I couldn't have been happier with the results that's been achieved thus far. I feel like I'm good for another 40 years maybe, and be one of those people from biblical days.
The heart can accommodate over time. Now, if something happens acutely, people will be symptomatic. They may be short of breath, they may have chest pain, because something happened. But if something is slowly encroaching on blood flow, there may be no symptoms. 50% of patients who have coronary disease come in with sudden death, they're dead, and we may or may not be able to save them. So this is another reason why, really after age 40, it's so important to have preventative testing, evaluation, treatment, and this is what I encourage to all my colleagues and myself to do that on a daily basis.
We came to the right place, got the right doctor, and I think it's all because of Dr. Varghese and what she had a hand in, and I'm very grateful, and I'm here. Can't beat that.
My main symptoms before seeing Dr. Nguyen were allergy and asthma. I've suffered from my entire life. The sinus headaches were very bad right before my surgery. I would almost have a daily sinus pressure headache so severe that occasionally I'd take migraine medication, and even that wouldn't get rid of them.
Emily is a nurse who came to see me because she can't breathe through her nose. She wants to find a permanent solution to her problem. As a nurse, she understands the abuse of antibiotics. She wants to get away from this cycle and find a permanent solution to her problem.
I came to Dr. Nguyen because I saw his segment on Best Docs one Sunday morning, and I had researched his procedure, so I came to him asking him to do the balloonplasty procedure. However, he had a more cautious approach. He wanted to make sure we did all the appropriate testing and make sure that this was the right option for me.
Emily is an appropriate candidate for the in-office balloon dilation procedure, a small in-office procedure to open up obstructed sinus drainage pathway. The procedure was done in my office. It took 45 minutes, and Emily was able to get back to work the next day.
The procedure was actually very easy. It was very nice not having to go under general anesthesia. The whole procedure took less than an hour. Dr. Nguyen and his assistant guided me through it. They were very helpful, they were very compassionate, and I found that it was a very comfortable procedure.
It's so rewarding for me when patients like Emily come back and tell me that after going through a small in-office procedure, she can breathe better and she can live better. She is more productive at work and she can spend a lot more quality time with her family.
The way I feel now compared to before I saw Dr. Nguyen is completely different. I feel energized. Seeing Dr. Nguyen and having this procedure done has really been a game changer. I feel so much better. I'm getting a good night's sleep every night. I'm able to breathe and have the energy to do the things that I want to do.
My problem, I had non-healing wounds on my left leg. It was due because of a blood clot that was from my ankle onto my groin, and I've had it for about 12 years.
When she first came to see us a number of years ago, she had pretty horrific wounds on one of her legs, and she was referred to me by a vascular surgeon that had told her he had nothing left to offer her other than an amputation.
When I initially saw Dr. Morgan, I'm his difficult case, I can tell you that. At times with the treatments, we would be in the treatment room for so long because of how bad my veins were.
We came to an agreement, about her legs, and the agreement was if she didn't give up on me, I would not give up on her. And we proceeded to go to work. Her wounds essentially involved about 80% of her flesh below her knee on the involved extremity. And it was full thickness, and you can literally just see muscles exposed. Most of the skin was gone, so these were really horrific wounds. And we set out to begin to close all of the refluxing vessels in her superficial compartment, and ultimately we achieved that, and she's had an amazing recovery and has almost completely healed her wounds, which is just incredible.
My life has changed dramatically with seeing him. I've been able to be more active, I've been able to work out at the gym and stuff. Before I couldn't do stuff like that. I was more depressed than I ever thought I was, but since I've been going to him, I've been able to work out. I've lost 60 pounds. So.
It's incredible. I will tell you that there were times where we thought we could never get it done. Her case was very unusual, the severity of it, and she just kept coming and kept saying, I know you can do this, and I kept saying, you're with me, I'm with you, and we stuck to it together, and in the end it paid off that she just had such an amazing result.
My everyday life has changed a lot. Dr. Morgan's a very nice, compassionate doctor. He told me he would never give up on me, and he hasn't. Now I'm gonna start crying.